we've been told by Carnival Cruise Lines is that this woman is a lab supervisor at this hospital where I'm at, and apparently took a vacation, went on the cruise lines, and now has quarantined herself, and that she is at very low risk. She is not sick. And Anna, this is the really important part. It has been 19 days since this lab supervisor was in the lab with the specimens from Thomas Eric Duncan. 19 days, that is almost at the 21-day incubation point. And so the chances of this person developing Ebola are very, very slim. Anna?
That is good news, at least. Elizabeth Cohen, thanks. Keep us posted. And let's bring in now CNN's chief medical correspondent, Dr. Sanjay Gupta. Sanjay, why are these people traveling seemingly so freely when they know they have been exposed?
Well, part of this is the question, should they sort of put it on themselves to limit their travel? They're healthcare professionals. They've had contact perhaps with the Ebola virus. And part of it is just sort of what are the rules and regulations. One of the important points here from a public health perspective is that, again, as Elizabeth said, if you're not sick, you're not going to be transmitting the virus. Very important. But what we've also heard from Dr. Frieden a few days ago is that there's this whole policy of what's known as controlled movement. And that means that if somebody has had contact with the patient who has had Ebola, then they can't travel by commercial airline. They can't go on a cruise ship with lots of people. They can go in a car somewhere. They can get on a charter plane somewhere. But they shouldn't be doing these movements with lots of other people. And that doesn't seem to be happening. People seem to be doing that. This other nurse here who's now in Atlanta flew to Cleveland and back. So they need to sort that out.
So would it make sense then for the CDC now to enact some new guidelines regarding this?
Yeah, and I think that's exactly what they're talking about now. They got to figure that out, and they got to figure out if someone has come in contact with someone with Ebola, if 21 days, maybe they're not going to travel in some sort of commercial way, or is it people who were directly caring for the person with a certain level of protective gear? It sounds like they're not going to have a blanket policy. They're going to have some levels of risk, and based on that level of risk, they're going to figure out what the travel should be. But I think they're going to get more detailed about this. The nurse, Amber Vinson, it sounds like, Anna, she wasn't told anything. She, in fact, was the one who called the CDC herself at some point and said, this is what's going on with me. So she wasn't told she couldn't fly. That needs to obviously be more spelled out.